We're here today to do a central line dressing change with the new central line dressing change kit that will be trialed for 6 months on Davis 8 and Tower 2 SI. The first thing I want to go over is what you need to bring to your dressing change. You will need the new central line dressing change kit. These should be found on your cart. You will need the 3M Advanced IV Tegaderm number 1685. You will need a bio patch, or if you are on Davis 8, a Gardiva, which is an alternate CHG patch that has a hemostasis property. And now, instead of using StatLock or a 3M securement device, you will need the new SecurePort IV tissue adhesive, and this is how we will be securing our PICC lines from now on. Lastly, you will need band net if you are doing a PICC line change. This keeps the line nice and close to the skin, and we would like to see that on all patients that have this to reduce friction on the dressing. And if you're like me and you have very small hands, you will need to bring your own set of sterile gloves. All right, let's open up our new kit and so we can go over what's inside. The beauty of the new Medline bifold kit is that if you forget a step, it will tell you by picture and text the next step to go to. So first thing we're gonna do is open this up, and we have 2 steps to begin here, the dressing removal, and then we will transition to sterile. The new dressing kit has all the steps clearly marked for you. So we're going to open this pocket up and get out our dressing removal supplies. Inside our first pocket, we have a mask for you and your patient. I know we're all masked at this time, but someday in the future, we might not be. So here's 2 masks, one for you, one for your patient. We have some alcohol pads to help remove the dressing. We have our hand hygiene gel here, so you never have to leave your patient's side. And we have some clean gloves to remove this dressing. At this point too, we're going to open up our transition to sterile so that we don't leave our PICC line uncovered for a prolonged period of time. So we're going to open this up and take out here. We have our sterile gloves here. We have our second hand sanitizer here, and we have our underarm drape. Okay, we're ready to begin our dressing removal. So we'll use our first hand sanitizer. These are our clean gloves, so you do not have to don these with sterile technique. We just have to place our clean gloves on. All right, at this point, we're gonna put our clean drape underneath the arm here. Okay, at this point, we're ready to open up our sterile drape. So we're gonna get our sterile gloves open and prepared to don sterilely on a separate surface. We're gonna get our sterile field prepared and ready to place our new dressing on, so that once we have the old dressing removed, we are just ready to apply the new dressing. We're going to drop a few things. We could drop bio patch. For this dressing change, I'll be using Gardiva. CHG disc with a hemostasis property. We always want to place this with the writing side up like any other patch. 1685 dressing. And the new SecurePort IV tissue adhesive as our securement. The first thing I like to do is open up a couple of alcohol swabs, just sort of to help you loosen some of the adhesive edges. So I think one of the first things to remember is that when removing Tegaderm, we like to use a technique called low and slow. And this basically, you want to peel back almost on itself to reduce the friction and trauma to the skin. We never want to pull up on a dressing. That can cause harm to the tissue and micro tears. And we're going to be using this site, hopefully, for quite a long time when somebody has a PICC line. The other thing to remember is that these dressings are perforated. The perforation allows you to remove everything at once without trying to remove excess tape that's on the dressing. So again, remember, we want to go slow and low and just use the alcohol to loosen if necessary. Low and slow all the way, and if your biopatch was placed correctly, it should come right off without disrupting your line. Okay, now we're getting ready to put our sterile gloves on. At this point, it's very important that we're extremely careful as to what we do touch and don't touch after we put these gloves on. Again, we have our hand sanitizer right here at our disposal. The important part of donning sterile gloves is that with your clean hands, you never touch the outside of the glove. First, we're gonna put one glove on using like a pinch technique with the cuff here. We put our first glove on, and with our sterile hand, we grab just the cuff of the glove and place our hand into it, never touching the outside with our hands. All right, now that we have sterile gloves on, we can arrange things on our field here. So the first thing to go over is step one. We want to cleanse with alcohol. So we have some alcohol swabs here that we can open and cleanse using a circular motion going from the inside to out. And this is super helpful to remove any debris or anything that was under the dressing that you really don't want. These alcohol swabs work great for that. Second step is to really scrub the hub with the CHG. And we want to make sure that we use a 30-second scrub. And all this is reminding you with the text on the new dressing change kit. Our CHG wand open, and we really want to scrub the entire area, the whole PICC. After you've cleansed around the line, it's important to break the glue bond. The glue bond will not be broken from pulling on the line in any direction other than up. When you pull your line straight up, your glue bond will be broken. And we have not seen this cause any damage to the skin or tissue underneath. At this point, it's really important to clean under your line and all surrounding areas. After we've cleansed with CHG, one of the most important things is that we wait for this CHG to be completely dry before we put down another skin prep or the dressing. All right, we're ready to secure this PICC line back down. The SecurePort IV is a vial of glue, and it opens up much like a syringe. So you use your index fingers and thumb and sort of just pop it. To get the glue to come out, you have to hold it to the most distal port of this applicator. The first thing you want to do is apply 1 drop of glue at the insertion site. Next, what I like to do is put 1 drop under each wing. Wait about 20 seconds for the glue to adhere. You would not do this if you were doing an actual sterile dressing change, but I do want to demonstrate how secure this line is with the glue. It will not pull out. At this point, we're going to get our Cavalon out, and we're going to sort of paint the borders with this barrier. It really helps protect our skin, and it actually helps our dressings adhere for longer. Okay, now we're ready to put our CHG disc on. In this case, we'll be using Gardiva. When you place any CHG disc, you always want to make sure that the perforation or the opening goes towards the catheter. So we want to place that like such. The SecurePort IV has quite a lot of glue for this securement. If you're having issues with your Tegaderm sticking and lasting a full 7 days, you can use the SecurePort IV product much like Mastisol using a technique called painting the borders. you can apply a little glue as such and make a little border where you know your dressing edges will be. Okay, now we're ready to apply our dressing. With Tagaderm, you never want to pull or stretch the dressing. It's important it just lay flat. Now we have our securement. We don't have an actual device, so what it's important is that we use the strongest part of this dressing to help adhere the PICC on. We want to put the white border over the wings like such. Help give it a little bit of securement. With dressings, rubbing them in place actually helps the dressing adhere. When we put the pants on, there are 2 tabs where there is no adhesive that you can hold on, and this is the technique I like to use when I place. Nice and easy, we smooth everything down. We are ready for our date label. It's really important that the date label go across where the pants and the body of the dressing meet to secure and close this opening here. And kind of pinch this closed and smooth it down, and it looks beautiful. Okay, now we are ready to date and label this dressing. So we will put today's date and the external length of catheter. All right, our last step is going to be to cover this with the band net covering. The edge of the dressing is most likely to come up due to friction. So the band net covering the site reduces the friction to the edges of your dressing. And we have completed a dressing change with our new kit.